Howdy, everyone. Happy Friday. Another awesome week in the books. Got a little cold this week, but we fought through it. We're still here. We're still kicking. This is our Friday roundtable discussion on Facebook Live where we talk about a certain topic every week. This month, we're focusing more on the opioid epidemic and pain pills as it relates to chiropractic, how chiropractic can help, and just in general, how you can live a healthier life. First of all, I have to start by saying go Blues. Beat the Lightning last night, 1-0 in overtime, taking the second wild card spot. I'm pretty stoked about that, especially with the way that they started off horrible to begin the year. So go Blues. Pitchers and catchers report soon. The Patriots beat the Rams. So all's well in the sports world right now, as it states from a St. Louis fan. Today, what we're going to talk about is how many health organizations, universities across the world and nation are coming out and suggesting that you begin a trial of conservative care before you take before you take medication for your back pain. So there's a couple things I want to address specifically, but one of my favorite quotes of all time is by Thomas Edison, and I actually just looked up on Snopes to see if it was like legit attributed to him, and it turns out it is. And the quote is, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, in diet, and in the cause and prevention of disease." So essentially what this is saying is what we as chiropractors do, which is that we don't give medicine because legally we just don't, and that's not what chiropractic believes in, but we interest people in the care of the human frame, and in so doing, the nervous system, the muscles, the movement of the body, which is ultimately where life comes from. Without movement, we are nothing, essentially. So what we're going to talk about today is some research that's just come out. I have a bunch of it pulled up in front of me, but leading groups like the American Pain Society, Harvard Health, and the American College of Physicians, as well as like the government of Ohio, something like maybe it was Ohio's Health Association, all just came out and recommended that people suffering from back pain seek conservative care, such as chiropractic. There's also physical therapy and other things, but obviously as a chiropractor, I'm talking about chiropractic, before taking any medications. And this is supported by decades of research showcasing techniques that chiropractors do, such as rehab adjustments to get motion back into the spine, soft tissue work. All of this we do in our office. And so all this provides a great amount of relief and actually, in my opinion, fixes what is the underlying problem without the risks of drugs. And this isn't to say that, I said earlier, chiropractors don't believe in drugs. It's not that we don't believe in drugs. I think that they're overused, but medication definitely has its place. It's just not in the nature that it is used right now, which is why I believe we have the opioid epidemic that we do right now. And thankfully, it's coming to the forefront of politics and healthcare today. So chiropractic, physical therapy, all these things are recommended before trying any medication for your back pain. Thankfully, chiropractic has evolved tremendously over our decade or a century more that we've been around. It used to be that medical doctors would recommend bed rest and medication, and we know now that for most of the musculoskeletal back pain issues that we have, not moving at all is one of the worst things you can do for it, save some exceptions, but we need motion. We need the spine to be moving because for a lot of us now, we find that lack of movement is what got us to this state that we're in now. It's sitting at a desk every day, driving to and from work in your car while you're sitting, then sitting for long periods at work, and then, you're stationary. You go home and you sit on your couch at night too. And this motion is what locks up our joints, makes our muscles get irritated, nerves get irritated. Everything that's bad comes from lack of motion. And so now we know that motion is the key to life. And a lot of research publication has shown that specifically movement and physician-guided exercise. So that's exercise that we give you in the office, as well as movement through the adjustment movement through just getting up and walking around, being mobile, are one of the best ways to quickly reduce your back pain. And we see that day in and day out in our practice, whether it be from a car accident or just from chronic back pain that you've had your whole life. People think that it's something that they've had for years, so it's obviously going to be around for years. And while it often takes more than one visit to treat them, it gets away pretty quickly, the pain. Now, the function is a different thing. Restoring the function takes a little bit more time, but chiropractors, like I said, have been doing this for 100 years, so this is our bread and butter. And now the good news is that the thing that we've been preaching for forever, which is that it's not only possible to find relief without drugs, it's actually the recommended source of your relief coming forward from lots of medical and obviously chiropractic-based sources. Now recommend that you go drugless first. Drugs should be one of the last resorts that you take. So a lot of cutting-edge practices have begun using, when we treat here, we're treating neuromusculoskeletal, which means that we're treating the nerves, the muscles, and the skeletal system. But also we take an approach that is a biopsychosocial model of treatment, and this means that we focus on the biomechanical, how you move your body, psychological, reducing the fears and re-injury, social, getting back to the activities that you love. That's the main thing that we want people to do, is get back to the activities that you love. Nobody likes to be out of sports or working out for a long period of time. That's one of my least favorite things to do as a practitioner, is tell somebody that they can't do some activity that they love. And so we focus on the biopsychosocial method of treatment and care. And this model also doesn't require any medication, drugs, but creates a awesome positive environment towards healing and towards recovery, getting better, that we love in this environment. We love treating our patients with the same TLC, tender loving care, that we would give to our own family. We're only recommending things that we would give to ourselves or to people that we love dearly. So with that said, thanks for tuning in, guys. If you guys have any questions, comments, or concerns, this has been our Friday Fireside Chat. Please leave them below or let me know, DM me, and we will get them included in one of the future sessions. So have a great weekend and stay warm, St. Louis. We'll see you in the office soon.